If you've had cosmetic surgery, or are even thinking about it, you've probably dived into the pretty confusing and sometimes downright scary world of post-op recovery online. The advice is all over the place, especially when it comes to massage. You're seeing these videos of super aggressive treatments, people saying pain is just part of the process, and you're left thinking, what is actually safe? What's going to help me heal and not, mess up this huge investment I just made? Well, those are the exact questions we're going to tackle today.
Yeah, we hear this all the time. I saw on Instagram that this squeeze massage is the only way to get that snatched look I want. Is that really true? This idea has just exploded on social media. But the answer, when you look at the actual medical science, it's a huge, resounding no.
So in this explainer, we are cutting right through all that noise. We're going to look at these popular myths, really understand how your body actually heals, and then check out the scientific proof that points to one very clear conclusion. A gentle approach is the key to a safe and successful recovery.
All right, first things first, let's tackle the biggest and honestly the most dangerous myth head-on, and that's this idea that you need to be squeezed and pummeled to heal the right way. So the whole idea behind this myth is that you have to physically force fluid out of your body through the incisions. But here's the thing, your body is already designed to handle this fluid on the inside. Using aggressive techniques is like trying to put out a fire with gasoline. It just creates more trauma when your body is at its most vulnerable.
You've probably seen these buzzwords online. Squeeze massage is, well, it's exactly what it sounds like. We're talking about unlicensed providers literally squeezing fluid out of your open surgical wounds. Then there's wood therapy, where they use these hard wooden tools to roll and press on tissue that's already been through major trauma. Both of these are not only incredibly painful, they're actively harmful to your healing.
Okay, so to really get why these methods are so damaging, we've got to look at what's actually going on inside your body right after surgery. It all comes down to the science of how we heal.
So let's meet the hero of your recovery, the lymphatic system. Think of it as your body's own internal, super efficient drainage and garbage disposal network. It's made of these tiny, delicate vessels right under the skin. It doesn't respond to deep, aggressive pressure at all. In fact, that kind of force can literally crush these little guys. What it loves is a gentle, rhythmic stretching of the skin. That's what gets it working.
And this healing timeline shows you exactly why being gentle is so important. In those first few weeks, your body is on high alert. Your tissues are incredibly fragile, new blood vessels are just starting to form. Applying aggressive force here is like stomping all over a brand new garden. You're just going to cause damage and set your whole healing process way back.
And the risks here are really, really serious. Forcing fluid out of an incision can lead to something called wound dehiscence. That means the surgical site literally splits back open. This doesn't just undo all of your surgeon's hard work, it throws the door wide open for some really nasty infections.
Okay, so if squeeze massage and wood therapy are a definite no, then what is the right approach? This is where we need to get super clear on the difference between what's a medical procedure, what's a therapeutic treatment, and what's just, flat out dangerous.
This table, right here, breaks it all down perfectly. Look on the left, that's surgeon-directed drainage. It's a medical procedure, done by a doctor in a sterile environment. Then in the middle, you have manual lymphatic drainage, or MLD. This is a gentle, therapeutic technique that helps your body clear fluid internally. And all the way on the right, that's the dangerous squeeze massage. It's often done by unlicensed people in non-sterile settings, and it comes with a huge risk of infection and tissue damage.
All right, so we've established that MLD is the safe, gentle way to go. But you might be asking, is it really effective? And the answer is a big yes. And the best part is, we don't have to guess. We have actual clinical data to prove it.
Let's take a look at a clinical study that compared patients who got MLD after a tummy tuck with those who didn't. This is where we see the real, measurable difference that proper post-op care can make.
And the results were, wow, pretty striking. A seroma is a painful pocket of fluid that can build up after surgery. The patients who got MLD were over 3 times less likely to get one. Look at that, just a 10% chance in the MLD group compared to 33% in the group that didn't get it. That's a massive difference.
And what about recovery time? Patients in the MLD group had their surgical drains taken out almost 3 days sooner on average. I mean, think about that. That's less discomfort, a lower risk of infection from the drain itself, and you get back to feeling like yourself that much faster.
And then there's the patient experience itself. This number tells the whole story.
The MLD group rated their recovery a super high 8.9 out of 10. That's way higher than the 6.5 score from the non-MLD group. They actually felt better, more comfortable, and less anxious through the whole process.
Okay, so the evidence is crystal clear. Gentle MLD is the way to go. But how do you find someone who actually knows what they're doing? And just as important, how do you spot the ones who could do more harm than good? Here's the mantra you need to remember. Gentle supports healing, aggression causes harm. Let that be your guide. Your post-op massage should never, ever hurt. Pain is your body screaming that something is wrong. A real MLD session is so gentle, it should feel calming and actually reduce your discomfort, not add to it. So here are your non-negotiable red flags. If a therapist does any of these things, you need to end the session, period. If it's painful, if they try to squeeze fluid from your incisions, if they pull out wooden tools or rollers, or even if they use oil or lotion, that's a huge red flag. Real MLD needs a specific skin-on-skin grip to work, and oil makes that impossible. These are all signs that the person is not properly trained.
So on the flip side, what should you be looking for? Here are the green flags. First, they need to be licensed, like a licensed massage therapist or a physical therapist. But that's not enough. They also need to be certified in manual lymphatic drainage from a well-known school. And finally, ask them about their post-op experience. You want someone who's specifically trained in post-surgical protocols. And don't ever feel shy about asking to see their credentials. A true pro will be proud to show you.
So, it all comes down to this, really. You invested so much time, money, and trust in your surgery. The recovery isn't an afterthought. It's just as critical as the surgery itself for getting the results you want. So the real question is, after investing in your surgery, will you also invest in a safe recovery? Choosing a gentle, science-backed path isn't an extra. It's essential for protecting your health and your results.